Hello everyone. Are you experiencing acid reflux or GERD? First of all, do you know the difference of these two? Well, GERD, Gastro-Esophageal Reflux Disease, and acid reflux are related conditions, but they are not the same thing. Here's the key difference between the two. Acid reflux. 1. Acid reflux is a common condition where stomach acid flows back into the esophagus, causing symptoms such as heartburn, regurgitation, and chest pain. 2. Occasional acid reflux, often triggered by certain foods or drinks, is normal and does not typically cause serious problems. 3. If acid reflux occurs frequently or the symptoms are severe, it may indicate GERD. GERD, Gastro-Esophageal Reflux Disease. 1. GERD is a chronic and more severe form of acid reflux. 2. It occurs when the lower esophageal sphincter, LES, the muscle that normally keeps stomach acid from flowing back into the esophagus, becomes weak or relaxes inappropriately. 3. People with GERD often experience frequent and persistent symptoms, such as heartburn, regurgitation, chest pain, difficulty swallowing, and chronic cough. 4. GERD can lead to complications if left untreated, such as esophagitis, inflammation of the esophagus, esophageal strictures, narrowing of the esophagus, Barrett's esophagus, a precancerous condition, and an increased risk of esophageal cancer. 4. Acid reflux, also known as Gastro-Esophageal Reflux Disease, GERD, occurs when stomach acid flows back up into the esophagus, causing a range of symptoms. 4. These symptoms can vary in severity. It may include 1. Heartburn, a burning sensation in the chest, often after eating or at night, is one of the most common symptoms of acid reflux. 2. Regurgitation, sour or bitter tasting acid backing up into your throat or mouth can occur, especially when lying down or bending over. 3. Difficulty swallowing, a feeling of food being stuck in the throat or a narrowing of the esophagus can occur due to inflammation and scarring from acid reflux. 4. Chest pain that can mimic a heart attack, especially if it occurs with other symptoms such as shortness of breath, sweating, or arm pain. 5. Dyspepsia, discomfort or pain in the upper abdomen, often described as a feeling of fullness, bloating, or nausea after eating. 6. Chronic cough, a persistent cough, often worse at night, can be a symptom of acid reflux irritating the throat and airways. 7. Laryngitis, hoarseness, sore throat, or a feeling of a lump in the throat, globus sensation, can occur due to acid irritating the larynx. 8. Asthma symptoms, acid reflux can worsen asthma symptoms, leading to coughing, wheezing, and shortness of breath. 8. Dental problems, erosion of tooth enamel and other dental issues can occur due to acid reaching the mouth. 9. Disrupted sleep, nighttime symptoms of acid reflux can disrupt sleep, leading to fatigue and daytime drowsiness. It's important to note that not everyone with acid reflux experiences all of these symptoms, and the severity can vary. If you experience persistent or severe symptoms, it's important to see a healthcare professional for an accurate diagnosis and appropriate treatment. Treatment and remedies. Treatment for GERD, Gastro-Esophageal Reflux Disease, and acid reflux focuses on relieving symptoms, healing esophagitis, if present, and preventing complications. Here are some common remedies and treatments. 1. Lifestyle changes. Dietary modifications, avoid trigger foods that can worsen symptoms, such as fatty or fried foods, spicy foods, citrus fruits, tomatoes, chocolate, and caffeine. Eating habits, eat smaller, more frequent meals and avoid eating late at night or lying down after eating. Weight management, maintain a healthy weight to reduce pressure on the stomach and lower esophageal sphincter, LES. Elevate head of bed. Raise the head of your bed by 6 to 8 inches to prevent acid from flowing back into the esophagus while sleeping. 3. Medications. Antacids, over-the-counter antacids, such as Tums or Maalox, can help neutralize stomach acid and provide temporary relief. H2 receptor antagonists. Medications like ranitidine, Zantac, or famotidine, Pepcid, reduce the production of stomach acid, helping to relieve symptoms. Proton pump inhibitors, PPIs, drugs like omeprazole, Prilosec, esomeprazole, Nexium, and lansoprazole, Prevacid, block acid production and are often prescribed for more severe cases of GERD. Prescription medications. Prokinetics. These medications help strengthen the lay and promote faster emptying of the stomach. Foam barriers. Prescription foam barriers can be used to coat the stomach and prevent reflux. Surgery. In severe cases that do not respond to other treatments, surgery may be recommended to strengthen the lay or create a new valve mechanism. Natural remedies. Ginger. Ginger can help reduce nausea and inflammation in the esophagus. Licorice. Deglycyrrhizonated licorice, DGL, can help coat and protect the lining of the stomach and esophagus. Aloe vera. Aloe vera juice may soothe the esophagus and reduce inflammation. Behavioral changes. Quit smoking. Smoking can weaken the lay and increase acid reflux symptoms. Reduce alcohol intake. Alcohol can relax the lay and increase stomach acid production. Manage stress. Stress can exacerbate GERD symptoms, so stress-reducing techniques like meditation or yoga may be beneficial. Medical procedures. Endoscopy, a procedure to examine the esophagus and stomach, often used to diagnose GERD and assess for complications. Esophageal pH monitoring, a test to measure the amount of acid in the esophagus over 24 hours, useful for diagnosing GERD. Lynx device, a small, ring-shaped device placed around the lay to strengthen it and prevent reflux. Conclusion. In summary, acid reflux is the general term for the occasional backflow of stomach acid into the esophagus, while GERD is a chronic condition characterized by frequent and persistent acid reflux, often requiring medical treatment to manage symptoms and prevent complications. It's important to consult with a healthcare professional before starting any treatment regimen, especially if symptoms are severe or persistent. I hope you learned some tips and guide in this blog. Thank you.